It took years for the country to get on top of HIV and tuberculosis testing and treatment, but the COVID-19 pandemic could reverse these gains. More than 30,000 people die of TB in South Africa each year. And experts say authorities need to use the patient-centric advances introduced during this pandemic to exceed pre-lockdown management and treatment of HIV and TB. Lindsay Dentlinger has more details for us.
A recent TB prevalence survey shows actual cases are far fewer than previously projected. Only around 60% of the estimated 390,000 cases have been receiving treatment.
A lot of the global predictions on what's happening is that 6 months of lost time for TB and HIV could cost us 5 to 10 years of recovery. And so what we don't want to do is emerge from COVID stronger and safer, but then have 10 to 15 years to recover everything else.
The lockdown resulted in a more than 50% decline in testing and 30% fewer cases being diagnosed.
Prior to this now third wave, we had been seeing some recovery. But clearly what we're really concerned about is what's going to happen now. We're probably going to see a dip. And, the background means that actually we shouldn't just be getting back to where we were, we should be exceeding that.
But doing better comes with challenges. A new form of the disease known as subclinical TB presents with almost no symptoms.
There are lots of things where we're missing, things we should be doing. People who are walking through the door with cough and who are not getting screened, or if they get screened are not getting a test. And we know we need to close those gaps.
In Cape Town, city clinics are now testing people who present with symptoms for both COVID-19 and TB.
We've actually started to see an increase in the number of TB positive tests being done, which is suggesting to us that people are more aware of the symptoms that COVID may present or that TB may present. And so more and more sick people are coming to our clinics.
Health experts are hoping, just like with COVID-19, people will begin to use a recently launched screening app to check whether they are at risk and to prevent the spread of the disease. Lindsay Dentlinger, Cape Town.